everyone. Kitty McCall-Smith here with Center for New Medicine and Cancer Center for Healing on our Monday practitioner Q&A. So please make sure to follow us. To sign up for our email, go to centerfornewmedicine.com or cancercenterforhealing.com. We will send you notifications and reminders each week on which practitioner is speaking from 4 p.m. Pacific Standard Time to 5 p.m. Pacific Standard Time. So what we are doing here is really creating a healing community. And we feel that a community heals you, and it's just like your family and your friends surrounding you each and every day. We want to surround you, and we want to provide you quality information about how to live a healthier lifestyle, what you can do to prevent, what you can do if you're diagnosed, what you can do with cancer, what you can do if you have autoimmune issues, all kind of chronic issues. Everything's open. If you would like to suggest topics, please email me at info@cfnmedicine.com, and I would be happy to take that, and we'll work that in. Remember, live from 4 to 5 p.m., you type in your questions, and we'll make sure to get them answered as much as we can. So with that, tonight, we're going to start with Molly Fini. Molly Fini is a doctor of natural medicine. She is, if you were looking for prevention and you want to know if something's brewing, it could be anything. She's going to go through that tonight. We're going to make sure it's very clear. She can diagnose with the biomeridian survey and the 3D body scan. Incredible tools. So with that, I'm going to start with Molly, and she's going to educate you.
Thank you, Kitty. So my name is Molly Fini, and thank you for all of you that are joining us on Facebook Live and here in the center. So the first thing that I'm going to do is we're going to talk about, I want to do some emotional talking tonight and how we can emotionally heal, but there's kind of a route to this energy testing that I'm doing, which, you know, everything starts with energy, whether it's physical, emotional, or, you know, any kind of things that you're going through. So I want to go start, and I know that a lot of you have already seen this, but it's kind of important to go through this so that we can see that disease starts at an energetic level. It's not just because we go somewhere and we get diagnosed, it doesn't mean that, oh, there's a toxin and that's where it started. Usually, I mean, toxins do contribute to that, but usually it starts at an energetic, everything starts in an energetic or emotional level. So we'll go through this first, and then we will focus more on the emotional event or how something happened emotionally, and we'll go from there. And anybody that has questions, please type them in as we're going along if you have questions, and we can answer them during or at the end, you know, during little segments that we're going to, you know, cover. So the first thing is there's a theory that cancer is a 12-year disease. Tumor formation is in year 8. But a lot happens in our body before that tumor is formed. It's not like we just wake up one day and we have cancer. It's not like today I'm healthy and yesterday I was healthy and today I have cancer. And that could go for any kind of, you know, cardiovascular event, diabetes, you know, any illness that you have. It's not like one day you're well and the next day you're sick. There's a lot that goes on in our body before it's even diagnosed, you know, through conventional medicine. And so specifically with cancer, it takes 1 billion cancer cells to form a tumor that's the size of a gram. And so you know that if you think about it in terms of 1 billion cancer cells, it took a long time to get to 1 billion. And so if it took 1 billion cancer cells in time to even be diagnosed by conventional medicine, you know that there was a long process going on in your body. And that's why early detection and prevention is so important, and just keeping track and getting tested to see is anything going on in your body. So after the tumor can get diagnosed, that's when we're in year 8 through 12. So it's like there's a big window of when you're in, you know, treatment, if you're in conventional treatment or even, you know, holistic or the treatment that we do here once the cancer is diagnosed, but there was a long time before that even occurred. So we know that everything starts in an energetic or emotional level. So there's some type of emotional event. And most patients that I scan, when we find out that they have cancer, there's always, like if they think back, they can think of an emotional event or something that occurred 10 or 11 or 8 years back, you know, whatever it is for them that really, you know, caused them to either their immune system was really suppressed because of stress or some emotional event, or something happened that was the lead up to the cancer. And so everything starts at an emotional or energetic level. That information travels to the meridians, and then to the nervous system, and then to the cells. The cellular level is where all conventional testing is done. X-rays, blood work, CAT scans, whatever the conventional medicine, what kind of diagnostic tools that they use to see that tumor. So this is when they do that. But look at all this time that happens before that's available, So it's like, it's a lot easier, if you're in this area, it's a lot easier to get out of cancer or some chronic disease before you hit this area. It's much more difficult to get out of this than it is right here. And so it's really important that you always do, preventative and early detection testing, or just taking care of yourself, whether you've read Dr. Keneally's books or just knowing how to take care of yourself. Lifestyle is a big, huge thing, and back to emotional thing, which we'll go over that. So what I do here is I test on these 8 system-specific anti-carcinogenic formulas. We call these Naturas. And so once I test you and find out what all your meridian pathways are and where you're out of balance. So the first thing I do is I want to find out kind of, your meridian pathways, which is the energy flow, which we can call it chi also. But I want to find out where you're out of balance, because that gives me a baseline to do the rest of this test. And then I will test you on the anti-system specific herbal formulas that are, like, for instance, in China, this doctor that we work with, his name's Dr. Wang, he believes in, and he tests thousands of patients, like, all over the world, and he has anti-tumor hospitals, he has universities, but he believes that we get cancer in a specific system in our body. It's not like there's hundreds of kinds of cancer. Is it in your respiratory system? Is it in your digestive system? Is it in your urinary tract? Is it in your ductless glands, which would be adrenals, thyroid, mammary gland, prostate? Is it in your lymphatic system? Is it in your blood? Is it in your connective tissues, your muscles, skeletal or nervous system and brain? So what I do is I have specific anti-carcinogenic formula herbs to test on each one of those, because what I'm looking for is an overgrowth of abnormal cells. And if you test positive for these, it doesn't necessarily mean that you have cancer. It could be you just have an imbalance. Like, for instance, when I went to China and studied with him, I've had issue with my lungs for a long time. I don't have lung cancer, but I've had an issue. And so he tested me, and I tested positive for the 101, which is lung, respiratory, and I don't have cancer. So patients need to understand that when they come in and test with me, I'm not really testing for cancer. I'm looking for an overgrowth of abnormal cells, which could be a lot of different things. It could be cancer, but it could be something else too. But these are very effective, and what I do is very effective, whether it's herbs, whether it's organic tea, whether it's homeopathics, whether it's just system support. What I'm trying to do is to find out what's going on with your body, why is it out of balance, and is there any overgrowth of abnormal cells, and what can we do to support you and to reverse what's going on in your body. And a lot of times, sometimes I find something here, but you haven't been diagnosed with cancer. But we don't know. I mean, sometimes down the road you might get it, but I'm just saying, if we can stop it in its tracks, it's a lot better than letting it get this far. So we all have about 75 million cancer cells, give or take, and if our immune system is strong, it keeps those into check. But what happens when our immune system is suppressed, which could be caused by, the biggest thing is emotions or stress, okay? But it could be toxins, it could be pollution, it could be so many things. It could be parasites, it could be fungus, viruses, whatever. But if our immune system is suppressed, it gives the abnormal cells the ability to overgrow and become uncontrolled, and that's when we can enter into this cascade. And once we're here, which we're all in and out of it all the time based on our immune system, but once we're here, that's when we really have to pay attention that we want to get out of it, okay? Because once you're here, your body keeps wanting to, get further and further into the unhealthy state. So we just always have to be tested and just take really good care of our body and do what we intuitively know, And, you see all this information about eating correctly, dieting, and I don't mean dieting like going on a diet, but I mean the diet, the food that we eat, and exercise and taking supplements. But the biggest component that is missing, that people don't talk about very much, is emotions. And that is as important or more important than anything that we can do. When I was going through my first course to become a holistic practitioner, this is before I got my doctorate, But the man in New York, he said, he owned a health food store, and he said what was interesting to him, and one of the reasons he opened this nutrition school is next door was a movie theater. And he said he noticed that there were some people that came into his health food store that were very healthy and bought all this health food stuff. But then when he went to the movie, those same people that looked pretty healthy were in the line getting popcorn and pop. And he's like, that really doesn't make sense. They're eating so healthy, and some of them, but yet they're not eating healthy here, and they look great. And then some of the people that he saw that ate really healthy all the time and took all these supplements, didn't look so good. And what he realized is it's this big, huge emotional component. And I can have people that come into my office and they'll ask me, this is one of the biggest questions they ask me, even if they take the Natura's. Let's say I test them positive for these Chinese herbs. They're like, how long do I have to take these? And, if I see you and see Dr. Keneally and do all of these treatments here, when will I be better? I mean, people ask me that all the time. And everybody's different. That's what I can say. And I said, but the number one thing is what's going on in your mind. What is your emotional state? Because I can see people that come in and that have full-blown cancer, and they're on, maybe low-dose chemo, and they have all these things going on, but they're negative, and they have a lot of issues, with other people in their life, and they just haven't, I guess, reconciled things, with forgiveness or whatever. And I can see them, I'll test them every 3 or 4 months, and their supplements and their herbs really aren't going down, and they have to keep getting these treatments, and sometimes they're getting sicker, but it's their emotional state. And I try to tell everybody, well, I do tell everybody, but whether or not they listen is another story. But then I see other people that come in that are very positive, and they're loving, and they're very helpful. I mean, they're just have the best attitudes, and I see them doing the same treatments or even less, and they're getting better a lot quicker. And so when people ask me that, I just have to say everybody's different, and it's kind of all up to you. Who are you as a person? What do you believe? What do you tell your body? Because it's like every thought that we have, and we'll get more into that, every thought we have has a frequency that our body responds to. So now that we've kind of gone through that, let me just go through this. So this is what I call emotional nutrition. So we have primary foods and secondary foods. I don't know if you guys can see this. Do you want to come up closer? You can come up. Oh, you're okay. You're good. Okay. So we have primary, secondary foods is bigger, is because everybody focuses on secondary foods. Secondary foods is, we eat nutritional foods, we take supplements, we feed our body as healthy as we can, and the saying, we are what we eat. But what most people forget is primary food, which to me, number one, primary food is what we feed our minds, what we feed, the thoughts that we think, how we live our life, what, we put in our mind. And that is, what kind of music do you listen to? What kind of movies do you watch? Is there any violence? Like everything that you're seeing, everything that's registering through your brain has a frequency, and your body's responding to all that. So it's so important to know how significant that is. So I have a few questions in my pocket that people emailed me, but one of them was somebody asked me, how do you increase your vibrational frequency? And the only way that I can say that, and what that means is, to think better, to have better thoughts, so that your whole body, your whole cells, every cell is at a higher vibration so that you can heal. And I did it, first of all, back up a little bit. So we did this about 6 weeks ago, but we couldn't post it because it was a little bit messed up. So I'm going to say some of the same things that I said in the last one, but I just wanted to say, so I did a little experiment, and what I did was I wrote down all the good things that I could think of, like all the good thoughts. So I'm thinking, okay, if every single thought or everything that we think of has a vibration or a frequency that our body responds to, then I'm going to be very conscious of what I'm putting into my mind. So I wrote down all of the good things that I could think of, the good words like happiness, compassion, joy, love, I put my grandchildren's name in it, all the people that I love, the people that are good to me, support, everything good. And there was like 100 things on the list, and I kept adding and adding to it. And I thought, okay, there's all these wonderful things. So now what I'm going to do is I'm going to read this every night. And I'm just going to see how long it takes if I can even notice a difference. So at night, I would read through this list. And it didn't take very long. I actually started memorizing it. So I was reading through this list. And the next morning I got up, and the first thing that I did is I started reading through this list again. So I was going through this whole list. And then when I came to work, the words, I would think these words. And I just made a commitment to myself. I'm not going to let one negative thing go through my mind. I'm going to just do this experiment because I just think it's so important if this really works. So I didn't let anything negative go in my mind. All I thought of in my mind was I just kept going through all these words, going through all these words. So all day long I did it, and when I wasn't with patients, when I was going up and down the hall, that's what I did. When I was in my car, I didn't listen to my radio. I was just going over these words. And I'm just telling you, in like 3 days, my whole consciousness changed. I felt so much love and so much compassion for everybody. Even like, you know how sometimes there's people in your family that kind of irritate you a little bit. You know what I'm saying? Or, you know, just people. And it's not like, it's probably not them, it's me. But what I realized is that I loved everybody. I had compassion for everybody. I wanted to help everybody. And those little things that used to bug me about maybe something that somebody would say or do, it didn't even faze me. Like, it didn't even faze me. It was just like, oh my gosh, I just love this person. And then I realized, what it made me realize is that all of that was about me. Like, if somebody bugs me, it's not the person, it's me. It's my own, you know, my own problem. But it just made me realize that that experiment was like amazing, that what we put in our mind, in our body, is our body responds to. So our cells don't know what reality is. They don't know what the facts are. They just know what we tell it. So if we're telling our body how wonderful we are, that we're healthy, that we're loving, that we're compassionate, guess what? That's what all your cells and your whole body and your whole being, that's what you're going to believe, and that's what you're going to think, and that's what you're going to radiate. And so I need to keep doing that experiment. I did it for a few days, and I realized it worked, and I kind of work on it. I don't do it all the time, but I'm just telling you that it's just amazing, and I would recommend everybody try that. I've had a few people that have done it, and the same, just telling you, it works. And we just need to practice on telling ourselves good things, listening to good music, reading good things, watching good movies. You know, everything affects us. Every little thing we put in our mind affects us. So, so nutritional thoughts also, we talked about feed and create healthy cells. So your thoughts change your brain, your cells, and your genes. Just think about that. Your thoughts change everything in your body. Like, not just the way you feel, but it changes everything. It can change your DNA, like everything. It's pretty amazing. So what flows through your mind also sculpts your brain and cells in permanent ways. So we can kind of, okay, so now another thing, I want to go through thoughts again and what our emotions are. So we know that emotions are correlated with different organs of our body. So, and I find this to be true. I mean, I've read about it, but I find it to be true because all the patients that I have, it matches. So somebody can come in and have, this is an example, somebody can come in and have liver cancer, and you know, I'll ask him, you know, because I try to talk about the emotions without offending anybody, and I'm like, do you feel like you get angry a lot? No, I never get angry. And I'm like, okay. So he has to get up and go use the restroom. So his wife's sitting there, and she goes, he is always angry. You know, so it's like a lot of times maybe we don't realize what we are. And just like when I was in China, this is the thing, is sometimes we don't realize what emotion that we put out to other people. So when I was in China and my lungs, I didn't know what I was doing or why I had this lung issue. And the doctor in China said, it's your personality. And I'm like, oh. He goes, it's nothing that I can do. I'm going to give you these formulas, but you basically have to change your personality because you're always going to have this lung issue. And I said, well, what is it? And he said, you're impatient. And I mean, my family can tell you that that's kind of a trait that I have, but I think I've gotten over it, mostly, because I meditate. I do meditation all the time. But I have found that I have been in situations where I'm impatient, and my kids will even tell you that. But that's what's affected my lungs so much, because it makes it to where my blood pressure goes up, and my heart starts beating faster, and then my lungs, I can't breathe. And that's been a constant problem of mine for like 15 years, is it's very difficult for me to breathe. So I have to, like, when I can't breathe, I realize, okay, it's an emotional thing. It's not a physical thing. I mean, it's turned into a physical thing, but I meditate. I do my TM meditation. I meditate and calm down, and I do my little experiment that I tried with all those words, and all of a sudden, I just feel calm and loving and like so accepting of everybody, and then I can breathe. So that's something that I've discovered about myself. Kidney is fear. So if people have kidney issues, it's usually related to fear. Spleen and pancreas are usually, and this is so true, like I'm testing somebody and their spleen keeps coming up, their spleen keeps coming up. They're like, well, I eat healthy, I do this and I do that. And I'm like, what kind of job do you have? And do you feel like you're an overthinker? And they go, oh yes, you know, and then their wife or their husband's like, oh yes, you know. So I just like can pretty much confirm all of the organs have a specific emotion, and that's why it's really important, and important not only to get your emotions under control, the negative ones, and to see how they hurt your health, but also recognize how powerful our thoughts are. Like just bringing a thought into our mind and letting it affect us to where we have a certain emotion, to where it affects our cells, it affects our organs, and then all of a sudden we're sick. But it all started back with a thought that entered our mind. Do you understand what I'm saying? So it's just like so important to recognize that all these things start with an emotion. And that's why it's so important. And that's why I stress that primary food is really, health is all about what we feed our mind. I mean, of course, all that other is important, but if we're not helping ourselves emotionally, then all the things in the world that we do is not going to heal us. That's the most important thing, is being healthy and being happy and loving. And just to get off base a little bit, so another test that I do is the 3D body scan, and I don't have any like visuals for it, but let me tell you a little bit about it because it goes back to emotions. So it's not an energy test like this is. The biomeridian or the bioimmune survey is an energy test where I'm testing all the acupuncture points and they go through all the systems and the organs in your body. But the 3D body scan, it's a bioimpedance technology, and it actually measures, it pre-screens for cardiovascular, diabetes, PTSD. It goes through all your organs and your tissues and all the cells in your body and your oxygen levels, and it tells you what you're deficient in and what vitamins you need, what food you shouldn't be eating based on your pH balance, and so it goes through all these things. But the reason I'm bringing that up, and not only do I do the test and it's amazing, but even though it's not an energy test, so I'm just telling you the difference. Even my energy test, it will tell me whether or not somebody has some emotional issues. But this other one, it's not an energy test, but I still know. So I've done that so many years. Somebody can come in my room and sit down, and it's not an energy test, remember, but before they sit down and test, I can pretty much, based on the energy of their body that I can feel, because I've tested so many people, I pretty much know, are they going to have heart issues? Are they going to have kidney issues? Are they going to have liver issues? And it shows it in a very different way than the biomeridian survey, but I can tell. And it's like, well, what are they deficient in? And it will also offer, plant therapy recommendations for different things. And I pretty much know what it's going to do. I mean, I can't tell everything before I start testing, but what I can do is just by the energy of somebody, and that goes back to our thoughts and our emotions, to understand that not only are we thinking it and carrying it around, but the people around us can feel it and they can sense it, And when we have emotions, like it really, it spreads far. It's not like it's contained in this space right here. It's like people can feel it when you walk into a room, what you're thinking and what you're feeling, not knowing exactly what you're thinking, but what you're, the energy that you're giving off. And that's why it's so important, whether it's a negative energy or a positive energy. But if they can feel it coming into a room, and I'm sure you've all experienced that, walking into something and you can feel the tension, nothing even has to be said, but what that's doing to your body, how important it is to be as clean and loving, and what I mean by clean is your thoughts, as clean and loving as you can be, because whatever you're putting out, more is hurting, in your body. They did an experiment, I don't know if you saw this, it was on Facebook, or I can't remember where I saw it, but in New Zealand, in the airport, they had 2 plants, and they were in glass cases, and there was a sign on both of them, and they said they were doing an experiment, and this is how our body works, and we just have to remember this. So this plant, they fed both of them the same, they watered both of them, and fertilized both of them, but on this plant it said, say as many mean negative things you can to this plant. Like, don't say anything to this plant, like yell at it, say all these horrible things. And down the way, there was another plant. They said, say loving, good things. Within a month, this plant was dead. It was dead. And the other plant was like thriving. But that's what I'm saying about energy. It's like, it doesn't even matter if you don't know the language or, you know what I mean? Plants, you know, do you know what I'm saying? It's like every thought and every word has a frequency and a vibration, whether it's a good one or a bad one. It doesn't matter, you know, how you're saying it. It's what you're evoking, the energy that you're evoking by saying that word or that thing. I mean, that's amazing about those plants. So let me just go to this one. So we just have to remember, and it's kind of like, I just have to stay in this space. Everything is spiritually or energetically created before it manifests physically, and that's what I've been trying to say. And it doesn't just take, I mean, it takes a while for it to physically affect you, maybe, but even like when you get upset really fast, you can feel your adrenaline, you can feel the cortisol. But I mean, as far as like having liver disease or liver cancer, maybe it took a while to get there, but a lot happened in our body before it got there, you know, based on, you know, the energy and what we're feeding our body. So every thought has a vibration that the body responds to, and our emotions are a record of the past. So we have over 70,000 thoughts per day. So can you imagine if you purposely, consciously put good thoughts into your mind? How healthy you would feel, how good you would feel. You know, I mean, it just really, like when I went through that experiment, it made me feel like a different person. Like I was just like, I mean, I don't want to say I felt like I was floating, but it was just like this energetic manifestation of like really goodness. And that's just how I felt. Like I don't think anybody could have done anything to offend me or bother me because I was like at a different level of consciousness. That's what it does for you. So feelings and emotions are recorded over time. And if you add, so a thought, if you add fuel, which is like an emotion, it changes the neural paths of your, you know, your body, your brain. And so it's like you have to think a good thought or a bad thought, and you don't want to get in those ruts, because if you get in a rut, you know, you still think the negative things. So you just have to constantly think good thoughts, and you can actually change it very quickly. So thoughts lead to emotions, which lead to actions, which lead to results that form your character. And so just remember that. So it's kind of a long process, but a thought can actually result in what your character is, you know. And Albert Einstein said this, which is so true: no problem can be solved from the same level of consciousness that created it. And it's the same thing as sickness. Nobody can heal in the same environment that you got sick in. So like if somebody got sick in a certain environment, they have to get out of it or they can't heal. Now I have a few questions that people, and if any of you have any questions, please feel free to ask. Let's see, I have some questions. Let's see. Okay. Oh, so somebody asked me, now you've had this test, right?
I had the whole body scan.
Oh, you had the 3D body scan.
Yeah, 3D body
okay.
scan.
Well, I don't know if you're, so this is, now we're getting off the emotions a little bit. Somebody's asking me, when you tested me, I had drops. What does that mean? So when I'm testing you, there's something called indicator drops. And what an indicator drop is if there is an interruption of flow of energy in the meridian pathway, it shows me that there's a disease or there's a beginning of a disease. And that's what that means. So a lot of times, like when I'm testing somebody after I get all the results, which I don't have a report right here, I have this. This is, excuse me, this is one of the reports we get, but this doesn't show the indicator drops. But I see where you're in balance and out of balance. And this is just a progression of somebody that this was their first result, and then their second, and then their third, so that they kept getting better and better. But an indicator drop just basically is showing that there's an interruption of flow in the pathway that shows disease. And how do you raise your vibrational frequency? Okay, we talked about that and talked about that little experiment that I did. So we talked about that. Why do you do parasite cleanses during the full moon? So a lot of people come in, like 85% of us have parasites. But our immune system can usually handle it unless our immune system is suppressed, and then we can have kind of an infestation, which we need to get rid of. And so what happens during the lunar cycle is the parasites or worms or whatever, flukes, whatever you have in your body, they connect to the tissue, the connective tissues in the cell walls. That's kind of where they live and stay. But during the lunar cycle, they release so they can reproduce. And that's why you do the garlic enema, which I recommend doing a garlic enema. You do it 5 days before the full moon starts. You do it 5 days I think it's 5 days straight, and then you stop for a week, and then you do it for 5 more days, because during that cycle, when they are reproducing, then you got to get rid of the eggs. So the first section, the first 5 days, is to get rid of the parasites, the flukes, or the worms, or whatever you may have. And then after you wait for a week, you do it again for 5 days, and then that's when you get rid of the eggs that were laid. Okay, do you have another
I
question?
have some questions for you.
Okay.
So I know that somebody wants to know when it's time for questions. Jen is on the line there, and she wants to ask you some. But if you must use antibiotics, should you refrain from taking the protocol of the Chinese herb and the naturas, or are they okay to continue during antibiotic course?
You know, it depends on the different doctors here. Some of them recommend different things, but I mean, my personal thought is sometimes it depends on what the antibiotic is. A lot of times you can take the Chinese herbs with the antibiotic.
Okay. Okay, that was from Chris and Jen.
Okay.
And then, great, Jen's on the line. I know someone who got through a cancer surgery. He's taking chemo now. How would amino help him now?
That's a tough question because, again, I don't know how, like, are they talking about amino acids? And I don't know what their case is. You know, I mean, some of these questions, I want to answer them all, but some of them are very specific to where they really have to talk to their doctor because I don't know how much chemo. I mean, there's so many different parameters in that question.
Okay, so let's go over a patient who wants to do preventative.
Okay.
Let's say that they come in and they want to know if something's brewing. Let's say they can't sleep, or let's say they have inflammation, or let's say they have candida,
yes,
whatever. Go through just on the center side for Center for New Medicine. If you came in at a preventative level and that you see Molly, what can Molly find out and uncover?
Okay, if somebody just came in to me and I would ask them, you know, why are you here? Because sometimes I make a decision if I would do the biomeridian or the 3D body scan. It's great if you can do both because they confirm information, but they're two very different tests. But if somebody just wants to find out how healthy am I, and I'll ask, well, do you have any heart disease in your family, or do you have any diabetic relatives, or any genetic illnesses? If they're concerned about that, I would do the 3D body scan because, as I said, it specializes in prevention and early detection of any cardiovascular or diabetes, and it will show everything that's going on in your body. But if somebody wants to know, do I have imbalances, and I want to know if I have any toxins in my body, I would do the biomeridian, because the reason I would do that is because, I would do the bioimmune survey, and the only difference between those tests is it's the foundation is the same test, but the bioimmune survey is I go a little bit further and test the Chinese herbs, because that's where I can find how serious that they have an overgrowth of abnormal cells. But if somebody just wants to come in for a quick check and say, I feel great, everything's great, I just want to find out if I have any imbalances. I just haven't been feeling, maybe up to par, but really nothing's wrong. So I would test them because maybe they have a fungus, maybe they have candida, maybe they have parasites, a virus, or maybe they just have, toxins. In fact, I scanned somebody Friday and they think that they're in perfect condition and they are in pretty good shape. But what came up was sick building detox. And he's just like, what? Then I just found out. So that is, I have 60,000 items in my database. So there's so many things that I can look at. And I'm like, well, where do you work? And he said, in a big building. And I said, is there any remodeling going on or whatever? And he said, yeah, we just finished remodeling. So for him, that's what came up, because he was just kind of like coughing a little bit. So for him, that's what came up. And so what I advised him to do, I'm giving him a homeopathic, but I also told him he needs to get a filter, like an air filter for his office, to get all that out of his office. So, it just depends on every single person's different, and you might be surprised when you come in what we find, because, he would have never thought that I would be going home and telling him to go get an air filter for his office. But that's what came up, and I didn't know that he worked in an office, and I didn't know that they just remodeled, but that's what I tested, and so that works. So it all depends on what the person's coming in for, but we can usually find things that match what's going on in their life. I had one guy that came in that just wanted a test, and he had a lot of mercury. A lot. And I said, what do you do for a living? Because I'm trying to find out. First, the first thing I would ask is, do you eat a lot of fish? And he says, no. And I'm like, okay, what do you do for a living? And he said, I'm a dentist. And that was it. I said, do you protect yourself? And he said, what do you mean? And I said, do you protect yourself when you're taking, I mean, do you take out a lot of amalgams? And he said, yes. And I said, do you protect yourself? And he says, no. And that is the first time that he realized. And so now, this was about 3 months ago, but now he's enrolled in dental courses to become a biological dentist because he realizes how damaging, and you know, a lot of dentists don't believe in that. They'll be like, that's ridiculous. But when he got that test, and I didn't know he was a dentist, you know, but that's what happened. And it was just fascinating. So now he's a patient here. He's just like, unbelievable. I can't believe it. Yeah, so now we have to get rid of all this mercury that, you know, he didn't believe that it could get into his system. You know, so you just never know when you come in what you're going to get. So,
so what about, and then anything chronic, like diabetes and osteoporosis? Just let's say somebody's worried about liver, kidney, or they can't sleep. I'm just thinking of what kind of things do you pick up in relation to the blood work that the doctor walked through with? You work with a doctor, practitioner
right.
here.
Yes.
So altogether it comes together as a story. So
yes.
Explain how you all integrate, work, and so how that a patient's information comes together and how that.
Okay, so the way that we look at it here is every one of us do something that's a piece of a puzzle. And we have so many different practitioners and so many different modalities that we do. And it's all important for whichever doctor is treating that patient to come to the full picture. You know, and sometimes it takes a while, but even once we have that picture, it's, you know, the treatment. You know, how long is this treatment going to be? Sometimes I see a patient before they even see a doctor because maybe they don't even know they have anything. But once I see the patient, I always give that information to, let's say, Dr. Keneally or Dr. Shannon or whoever, you know, whatever doctor's treating the patient. But the reason it's important is because what I can find is things that are not found in blood tests. And usually what I find confirms it if they have blood work. But what blood work? Like the sick building, detox, like there's no way that if, you know, that person got a blood test that would have ever come up, right? So the reason that they love the test that I do is I can give them, and if we go back to energy, I can pick up things energetically that there's no other test that can pick it up. And that's why it's so important, the test that I do, because I can, and some of the things are very obvious, like some of the things like, oh, his cholesterol's high, he has lipidemia, his blood glucose is high, and all these, you know, things that are really evident and obvious, but I never know until somebody comes. And sometimes, you know, Dr. Keneally will send me a patient that she's already gotten all the results and they're coming from someplace else and they've done conventional treatments, but she wants to start from scratch and like, okay, let's uncover what the other doctors haven't because we're starting over. And that's basically what she'll do, because it's almost like, you know, we all are like an onion and we all have layers, and it's like, okay, this is their standard treatment that they do for every single cancer patient, and this is what's happened. Some of the things, a lot of the things she has to almost undo the damage that has been done. I mean, wouldn't you say, the damage that's been done? So it's like, we're starting all over and we're starting from scratch. And whether she knows what's going on with the patient or whether she doesn't, we'll start with me and we'll find out what toxins do they have in their body, what damage has been done by the chemo, if there's been chemo or radiation. Let's get that out of their body and start all over and just start peeling back those layers. They might have candida, and the thing is if somebody has candida or fungus, there is no way that they're going to heal from anything until we get rid of that. So that's one of the first things that I look at, because like there's a website, I think it's called Cancers of Fungus. Everyone that I've tested that has cancer, I'd say 99%, they have candida or a fungus. I'm not saying that everyone that has candida or fungus has cancer, I'm not saying that, but the reverse is true. And until we get rid of that, there is no way you're going to heal. And I don't think conventional medicine, those doctors even look at that. And so Dr. Keneally really relies on me to find those things so that I can give her like the foundation of like, okay, this is what we're dealing with, and then she goes from there. Maybe somebody just has really low meridians and they just need, we have this 21-day purification cleanse that cleans everything in your body, and it's amazing. Like I can do a 3D body scan before and after that, and it is amazing. Like it grafts it. It will clean 38 things in your body, from your heart, your arteries, every one of your organs. It's unbelievable. We had one guy that did it and his eyes changed to blue. His eyes were always brown and they turned blue. But he was so toxic.
Molly, about how the 3D body scan, was it, the difference in that, and you had explain our, we get together, your practitioners all get together and talk about patient cases and collaborate each week, and you brought up a great subject of how blood work was done, but then you did the 3D body scan and you found and detected so much more, and together they really created
so this one specific patient, which this happens like all the time, but he got in all of his, because blood work, you got to realize there's so many different kinds of blood work you can do. There's no way that you can do everything and identify. So this guy got his blood work done and he was okay. Like he was, average. I mean, his cholesterol was a little bit high and his triglycerides and stuff. But when he came and got my test, so one thing that the blood test doesn't show, so he had kind of a weight problem, and it showed that his leptins were high. His leptin level was high, and that wasn't on the blood test. So that was one thing. And he had some heart issues that were not on the blood test. And then when he went and got a heart test, it showed that he had a heart issue. That wasn't on any of the blood work. And he had a lot of oxidation, and his homocysteine was high. Well, I asked him to go get a homocysteine test because the homocysteine is a really important test. It's an enzyme that's produced by the liver. And if you have like oxidized LDL, it acts as sandpaper and it can scratch holes into your arterial lining, and that's when the lipids and the oxidized LDL get into your bloodstream and give you a heart attack or have some kind of a cardiovascular event. And so when I did the 3D body scan and saw that he had lipidemia, he had all these things going on, I'm like, you have to get your homocysteine checked, you have to go get a heart test, and all these things. His homocysteine was high. And so that's just like, because we know that chronic diseases, most of them don't have any symptoms until it's like too late. And that's why when they do a 3D body scan, if something alerts me, I'm like, you've got to go get these tests because something could happen and you wouldn't know it. But it did also validate the blood work he had, but it just showed me 10 times more things that he didn't, and his thyroid was really low. It didn't show that, because blood work, you have to look at it as it's a measurement, but it doesn't always tell us the whole story. And not only does it not, what's balanced in the blood work, or what's the level that's like, oh, let's say it's between 20 and 30 and this is what normal is. That doesn't mean it's healthy, because they take the average of everybody, and it doesn't even mean everybody's healthy that's in this survey that they decide what the blood work is going to be. Do you see what I'm saying? So it's like this guy, I think he even said that his vitamin D was okay, and it was at a 50, which that's not okay. Like, you want it a lot higher, but that's what I'm saying. So I had an issue with my thyroid years and years ago, and I had like a huge goiter on my neck. I mean, I had so many health issues. I was in Huntsman Cancer Institute. I had to have nuclear treatments. I was in, quarantine. I mean, I'm just making a long story very short. But the reason I'm telling you this is the whole time, and it affected my heart. I mean, so many things. The whole time that I was going through all these treatments, my thyroid blood work was all normal. It was all normal. That's what I'm telling you, why it's so important. So if somebody comes to me and says, I don't feel good, and I can't lose weight, or I'm tired all the time, and the first thing I think of, well, let's look at your thyroid. And they go, oh, well, it's not my thyroid. And I'm like, well, how do you know? And they said, well, look at my blood work. It's normal. And I'm just like, I'm going to throw that in the trash, because it's not always, it's not always the story. You have to do more detective work. And that's why when we get all this information, we kind of put the whole thing together or get further testing. I've had a guy come in that the 3D body scan actually said that he had a prostate issue, and it kept coming up and coming up, because there's so many different windows that we look at. And he said, no, my PSA's fine. I've gotten it. I get it every 6 months. And I'm like, no, there's something going on. So I sent him to a specialist, and they did some tests, and they actually found prostate cancer. But it was so early, they reversed it in like 6 months. They said that wouldn't have shown up in his blood work for at least 3 years. And so that's why I'm saying the blood work isn't the whole story. It's valuable, but it's not always the whole story. And that's why Dr. Keneally has me do these different tests, because she can get, scans, she can get blood work, she can get x-rays, she can get all this information. But there's always, if we go clear back to this, and everything starts in an energetic level, and it's just cooking in the body, and it takes a long time for it to manifest into a physical symptom or a physical disease. Look at in your body that we can pick up that's not going to show on any kind of other test. So just, keep that in mind. Any other questions, Kitty? Anybody have any questions? Okay, great. Well, it was nice to have you all. Thank you for coming.
Thank you, Molly.
Thank you. Thank
Excellent.
you.